brakes are now, that without the push, sensors, yeah. Oh, Tyson. 208-221-5712. There we go. I can hear you. Lucas, can you hear me? Check, check, 1, 2. Can you hear me? Cool, cool. Okay, thank you. Governor is, hey, Andy. Yeah, I can hear you. Check, 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 check. Governor's here, so this will be right at 1:30.
Governor's on channel 1.
The governor's on channel 1. I'll be on channel 2. Thank you. Oh, they're having fun. I don't think they know they're live on digital. Just us? Oh, yeah, okay. I forget what this is. It's in here. Oh, yeah. Where are my car keys? Oh, my pocket.
An announcement right now. The governor is moments away from declaring whether Idaho will move on to stage 3 of the state's 4-phase reopening plan. Let me set the scene. You can see this is a live shot right now in the Lincoln Auditorium of the State House, where the governor will make that announcement in mere moments. Our Joe Paris is standing by there live. In the meantime, Doug Petcash, safely distanced from me here in the studio. And Doug, this is interesting. Today we have talked about this, well, since phase 2 opened 2 weeks ago, and whether the numbers would continue to allow him to open up phase 3 under those safety protocols.
Yeah, we did see that spike on Friday, Mark, where there was about 90 cases reported, most of them in the Twin Falls area of south central Idaho. But the governor has said that the one day like that probably wouldn't change his thinking as far as moving ahead to stage 3, which would be Saturday at 12:01 a.m. And so we'll be finding that out in just a couple of minutes when he speaks. So here is what stage 3 is all about. If it's given the green light, it will begin on Saturday, as I mentioned, just after midnight. Under this phase, bars would be allowed to reopen if they meet specific protocols, which include distancing and maximum numbers allowed inside. Now, gatherings of up to 50 people would also be allowed, again, under the safety protocols. Right now, it's only up to 10 people. Also, non-essential travel can resume as long as it doesn't include places with ongoing transmission. Also, that 14-day quarantine would be lifted for those who come to our state to visit. They'd have to, right now, if they're supposed to go into a 14-day quarantine, they won't have to do that anymore, Mark.
Well, as we found out, the governor is not without his surprises. When he opened up phase 2, he said the bars that were scheduled to open up in phase 4 would be moved up to phase 3. We are hearing rumblings there could be some outlets that are scheduled to open in phase 4 that may be moved up. So let's take a look at what the governor is going to be using to determine if we in fact will move into phase 3. The state is looking at graphs like this one to help make today's decision. It shows how many available ventilators and ICU beds are available right now in the state. And there are currently 506 ventilators and 130 ICU beds. Now that is well above the governor's mandate of 50 available ventilators and 50 available ICU beds. The governor said in a telephone town hall Tuesday afternoon that the state is more concerned with this graph than they are in that short spike, as Doug referenced, which happened last Friday. So this is really what he is looking at, Doug, and all indicators right now seem to point towards the opening of phase 3 on Saturday at 12:01.
It's good to see. Yeah, it's good to see that we have that much of a buffer. And the governor right now is at the podium wearing a mask, I might add. This is only the second news conference with people in person.
Well, thank you for joining us today.
Let's listen in.
We've been through a lot since March, when the first case of coronavirus was confirmed in our state. Sadly, 82 of our fellow Idahoans have passed away after contracting this unexpected and unwelcome disease, and more than 100,000 fellow Americans have died from it. Global pandemic was on no one's radar 6 months ago. Unlike the flu and related illnesses, there are still no therapeutics or vaccines for coronavirus, and we are far from achieving herd immunity. The highly contagious coronavirus could cause serious complications in 1/3 of Idahoans considered at risk if they contracted. But due to the sacrifices Idahoans have made in the past 2 months and the care they have shown for their neighbors, I am hopeful that we pass the worst of COVID-19 in our state, if we all continue to routinely practice measures to prevent its spread. Today, I am pleased to announce that we have met the criteria to enter Stage 3 of our Idaho Rebounds plan to safely and responsibly open our economy. Beginning Saturday, bars can open their doors as long as protocols to protect workers and the public are followed. We moved up the opening of bars 2 weeks ago, 2 weeks early, from Stage 4 to Stage 3. Only out-of-state travelers from areas of high spread should quarantine for 14 days entering Idaho. This will help our vital tourism and hospitality industry while protecting our citizens. Gatherings of up to 50 people can occur where appropriate physical distancing and precautionary measures are observed. In addition, after consultation with movie theater operators and our public health team, we decided to move up the opening of movie theaters by 2 weeks from Stage 4 to Stage 3 beginning Saturday, again, as long as protocols are followed. Over the duration of Stage 3, vulnerable Idahoans should be diligent to minimize exposure to transmissible moments. Employees should continue to telework wherever possible, and employers should continue to return employees to on-site work in phases. Visits to senior living facilities and congregate facilities are still prohibited in order to protect workers and the individuals in those facilities. Large venues and sporting events remain closed until Stage 4. Idaho was one of the last states with a confirmed case. Idaho was one of the first states with the staged reopening plan. On May 1st, 90% of Idaho businesses were able to open their doors. On May 16th, 95% of Idaho businesses will be able to open their doors. And on Saturday, nearly all Idaho businesses will be able to open their doors. We have been able to protect the health and safety of Idahoans while allowing our economy to open up safely. Every step of the way, we have followed direction from President Trump and the public health experts at all levels. Idaho's staged reopening plan and our handling of federal relief funds in prioritizing support for small businesses has repeatedly drawn praise from President Trump, Vice President Pence, and White House officials. We have distributed tens of millions of dollars in grants to help thousands of Idaho small businesses. We have helped thousands of Idaho small businesses obtain PPE so that they can open and help the public feel safe. We can be proud of all of that, but our battle with COVID-19 is far from over. We are better off in Idaho than elsewhere, not because the problem doesn't exist here, but because we're doing a good job of protecting our families, neighbors, and friends. As I've stated before, health and the economy are not mutually exclusive. They are interconnected. 500,000 Idahoans are at risk of developing serious complications from COVID-19 if they catch it. We cannot rebound if a huge segment of our population is afraid to engage in our economy again. They will engage, however, if they feel safe going outside of their homes to visit businesses and return to work. We all have a role to play in keeping them safe. Our personal actions are the most effective way to manage the virus and get our economy roaring again. Wear a face covering in public. Keep at least 6 feet of physical distance from others. Keep hands and surfaces clean, and stay home if you're sick. Even if contracting COVID-19 is low on your list of personal concerns, I urge you to still do these things. Prosperity and safety are linked. Protecting our citizens is the right thing to do, and our economic rebound depends upon it. The one and only reason we're able to progress through stages of reopening is because the people of Idaho, individually and collectively, have taken personal responsibility in slowing the spread of this new disease. We control our ability to make consumers and employees confident about going back to work and visiting places of business. Our personal choices matter. Thank you to the people of Idaho for your determination during these tough times and the care you have shown for others. Now, Dr. Chris Hahn will illustrate the data that allowed us to progress to stage 3. Dr. Hahn?
Thank you, Governor. As a reminder, as we move through each stage, and this is all on the Idaho Rebounds website, but we have set metrics at the beginning of this process for when would we feel comfortable moving forward based on how are people's health, what are the indicators we have that people are healthy and that our hospitals and healthcare system is in good shape. So starting with metrics that were created by the White House in the Reopening America plan, we looked at those and we took those as a starting point and we customized them for Idaho. And that's what we've been using all along, but we haven't previously gone through these during a press conference. We've had some great questions from many of you about trying to understand the metrics better and how we're making those decisions. As I mentioned, those are posted on the Rebound site, but you can actually go also to the database itself or to the data itself, which is displayed on coronavirus.idaho.gov. So behind me I'm going to talk about each of the three criteria, or the three types of data that we look at. The first is what we call epidemiologic criteria. So that is looking at how many cases of disease are we detecting, and also of all the lab tests we're doing, what % of those are positive. We don't want to just rely on the number of cases, because if we start ramping up testing significantly, which we're trying to do right now, we're trying to do more testing so that we do feel safe and comfortable, so employers know that their employees are well, so that people going into the hospital know that they're not going to be exposed, for example. Those types of testings are going to start to increase. We will pick up some more cases. So we look at the number of cases, but we also need to look at the bigger picture. So behind me, you'll see two indicators that we look at. One is the number of cases, and you'll see what's sticking out like a sore thumb is the one day in which a large number of cases were reported to us. And this was as a result of a large screening at an employer location that many of you are aware of. It came out in the news that there was a facility in Jerome that had some cases. So that large testing event, in addition to other testing that's going around the state, led to that bump. That's a good thing. We want to see more testing happening. We want to find out about these events. But at the same time, we need to look at other things. So you'll see on the bottom, it also mentions that to move forward, we either want to see a downward slope in overall number of cases, or we want to see a % positive test value of less than 5%. In this case, we did meet both those criteria. You can see that slope is just barely downhill because of that big bump there, kind of almost threw it off completely, but we are still meeting both of those criteria. The next area we look at is what we call syndromic data. This is data from emergency departments around the state. We've, for years, been collecting data from the emergency departments. They voluntarily send us every day just a count of how many people showed up in the emergency department that day with trauma, with, let's say, suicidal ideation, let's say diarrhea, those kinds of things. One of those things they report to us every day is how many people show up that have fever or chills and also have some respiratory symptoms such as cough, shortness of breath, difficulty breathing. That data is what we call COVID-like illness. So those are people that are coming in that could have COVID. We don't know that yet. They're not tested yet. They're not confirmed yet. But this data we get more quickly than waiting for lab results. So that data is tracked, as well as, so that's the upper graph that you can see there. The numbers bounce around a lot depending day to day, but you can see gradually those are trending downwards. The lower graph shows you, of those patients with that type of illness, how many of them were sick enough that they got admitted to the hospital. Those are the ones we really worry about. Those are the ones that we are concerned might have a severe COVID illness. And that has also been trending downwards. So we met that second criteria as well, which is looking at people coming in the emergency department with COVID types of illness. Our third category is kind of the most complex one, so I'm going to walk you through it. There's a bunch of different measures we look at. What we're trying to get a picture here is, how are the hospitals doing? Are they under stress and strain? Are they full of patients? If that was happening, we would not want to be progressing forward with opening up more and more, because we would worry about the hospitals getting overwhelmed. And I know the governor and the director, I would be remiss if I did not remind you all that on the graph that they so frequently bring to these meetings, that's that red line of hospital capacity. If we start seeing people being admitted to the hospital and there aren't enough intensive care beds, there aren't enough ventilators, that type of thing, we could have patients receiving less than optimal care. So above all things, we don't want that to happen. We don't want the sickest to not be able to get good care. So this last measure, which is about healthcare capacity, has several components. The chart you can see there, and I know we have handouts for you to look at this in more detail, and also this will be posted on the website, as I mentioned, to look at more detailed. But you can see there, this one looks at, do we have at least 50 ventilators and 50 intensive care unit beds available in the state? We well exceed that right now. We hope we continue to well exceed that. That 50 is that orange dashed line across the bottom of that graph. You can see there that we are well over that right now. We're comfortably above that. But if we start to see admissions in the fall, let's say for influenza, we could start to get closer to being concerned about our capacity. In addition, and I neglected to mention at the top of that page, there's also, we are not operating under what are called crisis standards of care. That's standards that hospitals can use if they are so pinched for resources that they actually can't provide usual standard of care. We are not at that place at all. We're very comfortably treating all patients with good standards of care. And then the third item on this page is personal protective equipment. I know you all have heard a lot about this, a very, very important issue. Are healthcare workers protected? Are they able to get masks and gowns and gloves? And indeed, our Office of Emergency Management tracks that. They get reports from the hospitals daily, and we are hearing that they have enough right now, at least a 10-day supply, so they feel like they're in good shape. I think we have one more page on this area. This is the metric that I think we're going to continue to refine, and we need to do. I'd like to see some different ways of looking at this, but this last area looks at our healthcare workers in more detail. Not just do they have enough PPE, but are they getting access to testing when they need it? Are they, if they do get symptoms, can they get tested? We need to do a better job, and we're working on getting a more robust way of measuring that. But in the meanwhile, what we do have is we have data on healthcare workers and how many of them are actually getting infected, which is a sign of a, if you will, it can be a sign, I should say, of a failure of the system. Healthcare workers are people too. They can go out in the community and get infected just like everybody else. So we know we'll continue to see some cases in healthcare workers. But if we started to see this rise, that would be very concerning, especially if it was at the same time that it was not the disease was not rising in the general population. So we're watching this metric, and as you can see, that is also going down right now, that we are seeing fewer healthcare workers infected than we were several weeks ago. So I think that's my last slide from this presentation. So I just wanted to kind of walk through in a little more detail. I know it's a lot of information, and again, because it's a snapshot, if you go onto our webpage today, our coronavirus.idaho.gov, you'll see data that's slightly different because a few days have gone by since we pulled the snapshot. But that's why we preserve this as a PDF for you to look at, and you can see this is the data that was used at the time the decision was made that we can move on to stage 3. Okay, thank you.
Okay, questions? Betsy.
Governor, why the surprise decision today to add movie theaters to stage 3 rather than holding those to stage 4 with other large venues?
Well, just like we always, our stage plan was we wanted to give everybody some predictability. So people could plan on calling their employees back, they could plan on purchasing supplies. But as Dr. Hahn just alluded to, we were doing pretty good in the real critical issues. And the other part of it is the industry came together and said, we think under these protocols, we would work under these protocols. And we looked at those protocols, and they met all the gating criteria for minimizing transmissible moments. So it was really an issue of we had some space in what we could do, we believe, going forward. They readily admit that even if they do open up, they'll probably quite a few of the operators we talked to said, well, they're not going to open up for a while. They're going to open up later. We got to continue to put confidence. But I would much rather start something a little earlier than have to delay things to a later point in time.
Governor, I'm with CBS 2 News. I have 3 reporters that have asked me to ask you questions. First of all, from Scott Logan. He has a 3-part question, so I'll ask all 3 and then you can respond.
Multiple choice?
Yes.
Do I just get to pick which one I want to answer?
You can ask,
okay.
Answer in any order. The state has added more resources to the Department of Labor. Do you have any indication how much it is helping with the volume of cases? Because we continue to hear from people who have been waiting as long as 9 weeks and still have not gotten any benefits and still don't know their status. That's A. B, do you know how much the state has spent to expand resources for the Department of Labor to deal with the volume of claimants? And then C, is there any indication that reopening has led to any significant rehiring of people who were furloughed or laid off?
Yes, no, yes. The question of the cost is in several different buckets. We approved, the Board of Examiners approved overtime. We've hired 19. They're hiring some more. We're actually looking at bringing in a call center. We're looking at bringing consultants in. I just looked at a case, a constituent, and these things are very, very complicated. I had a call with the U.S. Secretary of Labor, Scalia, yesterday, I believe, and when in our conversations we were talking about the PUA, the Pandemic Unemployment Assistance Program, he said when Congress was writing that bill, they went up on the Hill and said, please don't put this on the shoulders of labor who we know are going to be overworked as this wave of unemployment claims comes, but Congress just couldn't figure out any other place to put it, so that's where they put it. This is a universal problem in almost all states. Some states have yet to send out one PUA claim. We are working through our workload. What I can't tell you, and what I keep asking, is what date are we going to be caught up? Primarily for several reasons. One, people have to recertify on a regular basis, and if they don't certify, then they fall into the category of unanswered claims. Two, we saw what happened in the state of Washington, where there was an enormous amount of fraud. A lot of money went to hackers from the African continent, and we have in our state laws a very high degree of integrity that we want in the system to make sure the system works. Now, for that person that you alluded to, that I wake up first thing in the morning and think about almost the last thing going to bed at night that needs those benefits, that's of little solace if it's a claim. But we have all these hurdles of federal laws. We have all these hurdles of state laws that we have to get over. We are adding people, we're adding phone lines, we're adding consultants, we're adding call centers. I can't tell you, but we will get it to you about what the totality of it is, because it's in several different baskets. The Department of Labor is almost totally a federal program, and all we do is give spending authority. But of course, some of those dollars that are there are the dollars that the employers of those people have put into those programs. But the fact that we got 3 new programs all loaded on to a agency that their job 80 days ago was to try and find people jobs. But I'm not making any excuses. It's unacceptable. We're doing all we can. There are a few states that made a big conversion to kind of a cloud system with a lot of new technology. We have studied that a lot, but I don't want to unplug and turn the system all over, because that may risk the timeline of getting that out. We know afterwards there's some things we're going to change in our system, but nobody anticipated that in 2 weeks we would get the same amount of claims we had in all of last year. So I'm not making excuses for it. It's unacceptable, but we are throwing a lot of resources and a lot of time at it. Because they're from several sources, we'll have to get that to you. Oh yeah, we're making improvements. We're getting more PUA out. We're getting some of the other out. This particular claim I looked at this morning, the person, and of course, we always hear from the people that are getting money, but then when they get a big check with 6 or 8 weeks of back, they're mysteriously quiet.
CBS 2 Brian Morin is asking, what is your criteria if things don't turn out the way they should as far as number of cases or a trend? How would you gauge that to shut things back down again?
Well, I think Dr. Hahn addressed it. I told a lot of educators this morning in a call that we're going to go through stage 4, but then if we start having some of those graphs on that slide deck that Dr. Hahn showed, we have that change. I anticipate in consultation with our coronavirus working group and other people that it'll be more regional, our reaction. But I can't emphasize enough the importance of that red line. Almost everything in Dr. Hahn's presentation was about how do we maintain the integrity of that red line. And we've got a lot of places in Idaho where they have zero or no healthcare capacity. We need to remind ourselves, it seemed like it was years ago, but when this started 80 days ago, we ran out of healthcare capacity in the Wood River Valley, the Magic Valley, and we had to have overflow here into the Treasure Valley. We don't want that to happen. But that little red hash mark area right here, other than that period of time in the Wood River Valley is the only time we've exceeded our healthcare capacity. Is that fair?
Two more questions. Brian Warren, again, is asking, are you concerned about water parks? You know, with hundreds of people in water parks and even splash pads, you know, where they're all is there any reasonable indication that they can manage something like that where you've got hundreds of?
Well, there is guidance on all of these. I get, we have a call, well, I didn't this week, but I do every week with the mayors. And of course, cities have a lot of pools. There's guidance out there. Generally, a rule of thumb, being outside where there's a lot of UV light is better than being inside. You've got to have a much higher standard for a bathroom, but we have to have standard for bathroom, for restaurants, for all these other areas. That's where any place where they're congregated, where those transmissible moments goes up. And so that guidance is out there. And I know that the operators are very concerned about it. And, you know, some cities, they've decided not to open their pools. Other ones they have.
Last question from CBS 2's Denny Hawkins is talk about nightclubs reopening as bars. What does that look like?
Well, I mean, I told my team that I see in the guidance, no mosh pits. I told them how disappointed I was that I couldn't go to a mosh pit, whatever a mosh pit is. But the issue is transmissible moments. If you're in a bar or a restaurant and you're spaced out, your risk is lower. If you're in a nightclub where you're concentrated a lot more, or even a bar where you're concentrated a lot more, that's where your exposure is a lot more. So it's all about the transmissibility of this and exposure.
Governor, I have a question from James Dawson with Boise State Public Radio. He said, it's been almost 3 weeks since the state began its $300 million small business grant program, and we have less than 10% of that money approved for distribution. Have not as many people applied? Is there a backlog? If we reach the end of June and there's still 40 to 50% of funds available, will the program be renewed or extended?
Well, James's question about our Rebounds grants that started out for small employers from 1 to 19, and now they go from 1 all the way up to 49. And then yesterday, I think yesterday, we started for sole proprietorships. What's happened was when we first set that plan up, there were a lot of people that had applied for PPP through the Small Business Administration that hadn't made it through. Guidance from Treasury and other actions have opened up this SBA program, and a lot more people have fallen into that criteria. That's part of the reason that our forecast, our conservative forecast, that we might have 20-some thousand applicants is less because more people got those other programs. And we will continue to look at where we deploy that money. Our Corona Financial Advisory Committee and I are committed to taking that money that was the intent of Congress was to help take care of Corona-related expenses, and we will continue to do that. We'll look at other options going forward, but I am surprised that we haven't had a higher application, but I think it's some other funding sources that have taken care of it. The one thing that we're implementing right away is if you were one of those people that had a PUA application in, Pandemic Unemployment Assistance in, and it was a big hassle, you can send a note and say, I'm denying my claim on PUA and I'll take a rebound grant to try and line these programs up. I want to remind everyone that the unemployment programs were written by Congress with a lot of state laws and a lot of federal laws. Our rebound grants were written by us, And in essence, we opened applications on Monday and Tuesday night, we're getting checks out. That's the difference between writing your own rules and having some flexibility and having a mishmash of state and federal laws that exist in the unemployment area. Joey.
You mentioned movie theaters can open up on Saturday. What about outdoor theaters like the Idaho Shakespeare Festival, for example?
Like the which one?
The Idaho Shakespeare Festival, the outdoor amphitheaters?
Well, outdoor theaters are, well, it depends upon how many people are there. In stage 4, right now we've got you can have the Shakespeare Festival with 49 people. I'm getting a lot of head nods over here. They have to nod their head. They can't just smile anymore.
Governor, this is Jacob from the Idaho Statesman. Could you clarify a little bit the difference between a bar and a nightclub? Is it merely just the issue of capacity, or is there some other distinction that, between the two?
Elke, is there well, I think generally it's transmissibility. It's if it's a bar and people are sitting down at tables where you can have some of that spacing that I talked about earlier, but if you're a nightclub where you're trying to maximize the number of bodies in there, dancing is the biggest component of it. But you can still take the nightclub and say, we're going to put tables around, we're not going to have dancing, then it's, the issue is the transmissibility, and the more concentrated people are, the bigger a problem it is.
Governor, I'll give you a question out of left field, so we have some time here. I've talked to some of your experts, interviewed Daryl Anderson with Idaho Power, Dr. Souza, St. Luke's. It's clear you've taken kind of a middle ground approach to this reopening, they say. You could go faster, some people want you to, some people say you may be going too fast. I know you have all these models and experts, but the question I have is just your belief system, your intrinsic value system you're using to make these decisions. You said people are going to be hurt either way. A lot of people in the state are hurting right now. You go too fast, some could get sick, even die. Not fast enough, people won't have a job or money. There are consequences for that. So what intrinsic value system or internal belief system are you relying on when you make these decisions?
Well, Keith's muffled question was about some of the input, very sincere input I had about our 4-stage plan that we put out. As I stated about the movie theaters, I would much rather accelerate things and still give people a prior notification that I would slow things down. As I alluded to, we're one of the first states with a stage plan announcement when CDC, the White House said, as we unwind our recommendations about all the orders on a national level, you need to have a way to incrementally open up your economy, and that's what we did. There's actually 3 things that I can think of. Somebody might give me a head fake about more of them. One of them was the quarantine. A lot of people in the and the committee that you alluded to that Daryl Anderson chairs, that committee talked about it, is if we have people that want to come to Idaho from another state and they're not coming from an area that has high infection community spread, then they're welcome to come here. That was a change. We obviously moved bars from 4 to 3, and we just moved movie theaters up. So there was some of that. I still think, because of my epidemiological experts and advice, that we do these things in 2-week increments so that we have time to see the net effect of what the last opening did. Some things happen a little faster, some happen a little slower. So I'm satisfied in my own mind that we have done the right thing by saying we want to keep people safe. But also, as I alluded to, there's not a safety silo and an economic silo. A lot of these people I talk to in the restaurant, in all these other areas say, we can open up and nobody's going to show up if they think their health is going to be a risk. So I have to do this to where people have confidence so their employees show up, so their customers show up, and that's where I believe we are today. And knock on wood, if the people of Idaho continue with the behavior they've had in the past, we'll continue through stage 4, and then we'll look forward from there. Betsy.
Clarify on the question of bars and nightclubs. Bars up into stage 3 rather than stage 4. Was there a difference for nightclubs? Is it only bars that don't have dancing? Are you drawing a distinction there?
No, if you've got a nightclub, you're still in stage 4. If you have dancing, if you've got higher concentrations, you're still in stage 4. We're saying if you have a nightclub, you want to have less density, less opportunity for transmissible moments, you can move up into the bar category. So it's all about, and of course, you know, we've got restaurants or bars that serve a little bit of food that there's kind of this gray area. Do they serve corn nuts and all of a sudden they're a restaurant? Well, the difference is, do they get food inspection? Are they inspected? That's a clarification between a restaurant and a bar, and the difference between a bar and a nightclub is dancing, and higher density is standing.
Governor, this might be a question for Dr. Hahn, but
I hope so.
But as of right now, what is the percentage of positive cases in the state? I know the threshold is around, under 5%, but I just want to.
I'm gonna swag it, and then I'll let Dr. Hahn either nod yes or no. I think we're at 3.7%.
Yeah. On the handout, you'll see it.
Yeah.
We reported everything.
And as we, as hopefully, as we ramp up testing, that will go down. But if we ramp up, and if go back to the testing plan, but if we ramp up testing in areas where we know we've got spread, it'll go the other way. But as we, if we tested everybody, the number would go way down.
Governor, another question from James Dawson with Boise State Public Radio. The testing task force's plan calls for testing 150,000 people each week. Idaho is supposed to get 40,000 kits from the federal government for May and June. But aside from that, how is the state planning on bridging that gap? Is the state going to try to acquire its own testing supplies?
Well, the state, our Idaho Office of Emergency Management, some of the PPP, we've been acquiring that right now. But the infrastructure is hospitals, private entities. We've got major drug chains that are doing some of the testing. It is, if you read the testing report, it's all hands on deck. Anybody that will meet the quality criteria, we want doing more testing. And one of the issues with testing is, and that's one of the reasons I'm delighted that all the experts have agreed to stay on the testing committee, is we're going to have new testing, whether it's going to be a less invasive nasal swab, whether it's going to be a saliva test. I want to continue to have a team of experts that analyzes that to make sure that we're okay. I would love, before we went back to school, to have a saliva test for at a minimum, every school teacher. And I was just on the phone with the Supreme Court a little bit ago. We've got a backlog of jury trials, and Director Jepson and I were just talking about what do we do about testing of jury pools.
Katie Clark, Idaho Business Review. If we're ramping up testing, who's paying for all of that at $100 to $150 per test?
Well, it depends. I think our carriers, and Director Jepson can help help me finish up. Our carriers in Idaho are being very generous about what they're doing. Director Jepson administers Medicare and Medicaid, and a lot of it's covered there. There's individual businesses that are doing some of it. So there's a variety of people that are paying for the testing. And, you know, if we have these, some of these very concentrated food processing facilities, in some instances, those employers are paying for it. In other instances, other people are. A lot of times it's your local hospital, but the pharmacies, nationally, the national pharmacy chains are at least providing it, and then the carriers and other people are trying to help. But there's probably a dozen different sources of revenue to pay for the testing, and we'd like to get the cost down.
Governor, a question from Nicole at the Statesman regarding the cases in the Latino community. What is the governor's office or any of the coronavirus task forces doing to address the disparity? Are there any plans to specifically help the state's Latino population or Spanish speakers given these numbers?
Yes, there's multiple things going on that went on from the very onset. The Hispanic Commission, how we're reaching out, what documents are on the website, and the fact that there's Spanish language documents on the website, outreach. Obviously, in a lot of instances, the demographics in some of these food processing facilities where there's a lot of transmission are in areas that have a high percent of the Latino population. So that's part of the issue. But we recognize anyone that's in an area where they're going to have high transmissibility, and the Latino community in particular. We're trying to do all we can to outreach from an education standpoint. We had one of the events we had recently, somebody from the Department of Health and Welfare that was very familiar with the epidemiological work we needed to do went over and helped with the testing. So there's a variety of different tools we're using to address the Latino community in some of these areas. And their percentage in some of these areas is higher, but their percentage as far as being afflicted is actually lower. Betsy?
Governor, your plan for stage 3 mentions one item that you didn't refer to today, and that is the resumption of non-essential travel. Still in there?
Well, actually, non-essential travel is you know, the recommendations that I talked about you know, phasing in more people showing up, but non-essential travel. If you're coming from out of state, if you come from a high spread area, you're supposed to self-quarantine for 14 days. If you're coming from somewhere else, then it's, you know, that's part of opening up in stage 3.
Let's say Idahoans traveling far across the state for recreational. That's something that was part of stage 3, or is that allowed already?
Stage 2, wasn't it? Yeah, that was in stage 2. Stage 3, it's open.
Thank you.
Joey?
We get a lot of questions into our newsroom every day about masks. It's pointed out that if you go to a grocery store, very good. If you go to a grocery store, for example, a lot of the employees or all the employees are wearing it, but the shoppers, some are, some aren't. What's the guidance? Should you be wearing a mask if you're in a retail store, in a grocery store?
Yes. Well, was Stanford that did the study, came out last week or 2 weeks ago. Dave's nodding. I can just barely see his eyes because of his mask. 80% of, if everyone wore a mask, 80% of the spread of the coronavirus would go away. It's an epidemiological fact that, and of course, my mask is for you. And when you go into a retail establishment, like the question, what you're doing is being respectful, particularly of the clerk that waits on you. I am very proud of the people of Idaho. I'll plead guilty. I was one of those people when I traveled and went through an airport and people were wearing masks. I thought, well, there's a paranoid soul. But as we learn more about, and this coronavirus is different, the infection rate, the transmission rate, all those other things basically beg for this kind of practice. So wearing a mask is just the right thing to do. Now, when you're out, when you're outside, particularly when you're out in the sunshine, if you don't have a cough or anything and you're not being close to anything, that's totally different. But if you're in an enclosed environment, the circulation is maybe of question. Wearing a mask is the right thing for you to do, and it's the right thing for you to do for everybody else. Go ahead. Oh, one more. I thought you had one, Clark.
Yeah, Governor, thanks for doing this. Clark Corbin with Idaho Education News. Can you tell us a little bit more about your testing strategy and the comment that you made about a saliva test being available for all educators, and then maybe a little bit about the call you had with educators this morning? Thanks.
Well, the call I had this morning was with the career counselors and the presidents of the higher ed institutions. And, you know, I kind of gave them a pep talk about we're going to open up colleges and universities, and my goal is to have all the K-12 schools open, and how they're all different. You know, higher education have already been working on a blended model where they're doing more online delivery. K-12, as you know very well, there's a big disparity between districts that had a big online presence and an online component and ones that didn't. One of the issues is going to be we have schools where a lot of the teachers are older. We've got schools where a lot of the teachers have got underlying health concerns. And the school districts and our working group is working on each individual school, kind of what the protocols are. My issue about the saliva test is there is just a lot of unknowns in the testing. Everything from new antigens to antibody testing to the traditional PCR testing to what the less invasive nasal collection to all these other ones. I just want to be on top of it to where if something comes around, we're able to expand our testing capability to whatever population needs to be done. And obviously input from the educators is going to be critical. But if you look at the testing plan that we released last Friday, there's a good roadmap in there, but we've got some other things. Convalescent long-term care is critical. Corrections and jails is critical. The most critical always is healthcare workers, which is why it's one of the criteria on Dr. Hahn's chart. But as we now have I don't know if we got any critical analysis of our testing plan. Actually, the vice president wanted me to talk about it on a call this week, but I had to leave and go on another call. But they've seen our testing plan, and they're enthusiastic about what we've got, because we've got a real good roadmap on as capacity becomes available, where do we put that capacity to address the long-term needs of the state.
I actually have one more, too.
Oh, no, you said one more.
From Idaho Public Television's Melissa Davlin, is there anything being done to make reporting to the state more uniform among the state's 7 public health districts, especially when it comes to times they get test results to the state, demographic information, etc.?
I'll let Dr. Hahn address this. The health districts are not ultimately accountable to either Director Jepson or I. They have their own boards, but we've got a good relationship with them. But if we say at 5 o'clock we're going to release the numbers, and somebody gets a test result at 4:59, you know, obviously they're going to be off one. I can tell you that in all the conversations, our coronavirus working group, all the conversations I have with the three people standing around you, the long-term integrity of those numbers is the number one issue we're worried about in Idaho. There'll be a little difference in reporting. There'll be a little difference sometimes in the heat of trying to get the results back to an infected person or their doctor. We don't know what county we're from. We don't know, health districts overlap hospitals. So there's a lot of complication, but I will guarantee you the fidelity of the totality of that data is as good as it can be. We'll continue to refine it as we go forward. Our intent is not to hide anything from anybody. We want it to be accurate. The most important thing in this whole issue is that these people up here, we maintain our credibility with the people of the state of Idaho. All those things I talked about in my talk about the progress of Idaho, it's incredibly important for the people of Idaho to have confidence that as much as we're struggling through this, that we're doing the right thing and that the data is the data. Dr. Hahn, do you want to?
Yeah, thank you. In addition to what the governor said, today, knowing that we had the press conference, I actually went into each health district site and looked at their numbers compared to our numbers. And, I'd say, oh, in this county, I see one case there that we don't know about yet. We'll know about it tomorrow. So I think there's the challenges that people that look at the two data sets and feel like they should always match 100% at every given moment. Like the governor said, we pull the numbers once a day, and if the health district learns about a case an hour later, they're going to report it. They want to report as quickly as possible. We may not know about that case until the next day. But to the question about how to improve, we do realize that we made it through this first wave, and it was an unprecedented amount of work thrown at the local health departments, thrown at all of us. There were some times when the data lagged, when the data had to be cleaned up, was messy in the beginning. And we are working on using some of the funding coming into the state to improve our data reporting systems, to have them help hire up contact tracers, folks like that. So we're hoping that if we get hit really hard again, we will not get behind on the data, so that the data is, even as the workload increases, that we're able to maintain that integrity of the data.
Dr. Hahn, can you cite that Stanford study? About 80% of infections being prevented by mask.
Yeah, let me send it to you. I know I've seen it, but I can't, unfortunately, I don't remember the name of the author or anything like that off the top of my head, but Betsy, I'm happy to send that to you.
Thank you very much.
Sure. Okay. I think that's it.
Okay, thank you.
So you've been watching the governor's address there at the Lincoln Auditorium at the State House, and despite the fact that he opened up his address with the words, "We are far from achieving herd immunity," he announced, despite that, we are in fact entering stage 3 on Saturday at 12:01 a.m. Doug, the wild card here was, we knew that bars, breweries, wineries, distilleries, pools, splash parks, water parks, groups from 1 to 50, that was the next phase. Mm-hmm. We didn't know about movie theaters until today.
Yep, and he moved them up from phase 4, which would have been 2 weeks from now if all goes as expected. Now those movie theaters can open under phase 3. Of course, this has to be with proper social distancing, and so you're not going to see jam-packed movie theaters. The question is now, only groups of up to 50 people can get together, so it sounds like movie theaters can open with less than 50 people in their theaters. Now, bars, as you mentioned, would be allowed to reopen if they meet specific protocols. That includes distancing, maximum numbers allowed inside. And the governor also announced today that, Mark, the movie theaters will be open in stage 3. Large venues, however, remain in stage 4. Gatherings of up to 50 people would also be allowed again under the safety protocols. And stage 4 would allow gatherings of up to 250 people with proper social distancing. And so that's really where we might see situations like the Idaho Shakespeare Festival being able to open with a larger crowd or large event venues as well, Mark.
That's right, and it was a bit refreshing to see the governor has not lost his sense of humor when he said, I'm disappointed that I can't take part in a mosh pit. He said, adding, whatever that is. A mosh pit is. Yeah. Let's go to Joe Paris. He was there in the room with the governor. Was there any clarification on what exactly a mosh pit is for the governor? Joe?
Mark, I can tell you from personal experience, it's a lot of people running into each other, very close quarters, so mosh pitting will have to wait. No social distance there, but a setting that you might see that is a nightclub, and there's been a conversation online, it was talked about in here about the difference between a nightclub and a bar. You may have noticed that bars are now allowed to open on Saturday. Questions have been asked, though, about nightclubs. I'm going to read you the guidance here from the state. They say nightclubs remain closed except can open as a bar if business protocols are met and develop plans for operating as a nightclub with diminished occupancy for stage 4. The point here is that they don't want to just keep places from not running, but they want nightclubs to just serve drinks. They don't want to have these large crowds together. So if a nightclub can operate as a bar, have an area where they can separate people, not have a common area where people are interacting, then they would be more safe with that. Another thing that we need to point out here is just because the group settings here in stage 3 have been increased to 50, that doesn't mean that the health protocols go away. Governor Little talked about the importance of social distancing, the importance of wearing a mask. I asked him point blank, should people be actually wearing masks in retail stores, also in grocery stores? He said yes. And in a follow-up question, he explained that it really is a common courtesy at this point to wear a mask. You may not be sick yourself, but you're preventing other people from being sick. So if you are going into a grocery store, for example, Governor Little says he wants Idahoans to be wearing masks. Another conversation happening about water parks. They are going to be able to open on Saturday. Again, all these businesses had to develop plans to ensure there'll be social distance and that it can be as appropriate as possible. Governor Little reiterating, though, the outdoor activities in small groups, no problem with that. So a lot to digest here, Mark and Doug, but again, the big takeaway as well, movie theaters have been moved up into stage 3. They're just going to have to follow some new protocols. Again, bars will be open on Saturday. They do have to follow strict protocols.
Yeah, and you know, the governor even mentioned, Joe, as you heard, that he's talked to some of the proprietors of these movie theaters, and they've said, well, they may not still open on Saturday. They may take their time to make sure they do everything right.
But the one thing, though, Doug and Joe, and I want to bring Joe back in again, is the monitoring mechanism that is really unclear in this. And the protocol is so specific about you cannot sit at the bar. Your establishment has to have 50% of what its listed capacity is. Tables 6 feet apart. We've seen the pictures of other states that have opened their next phases in Missouri, in California, and we've seen those pictures. What is going to guarantee that we don't become the next national headline?
Peer pressure.
Well, the truth is, Mark, there's no guarantee. This is on the business owners to develop a plan or a socially responsible plan, keeping their patrons and their employees in mind. The truth is, there's not going to be a police officer going into every single bar to make sure that everyone is 6 feet apart. It's on the business owners, and the governor touched on it, that it really is a socially responsible thing to do, is to keep people healthy and to encourage the social distancing and the masks.
Well, if we want stage 4 to open, it's going to require that they do self-enforce this. I think that's pretty obvious.
And people sitting next to you or 6 feet away from you and making sure, you know, that others are respecting their space and whatnot as well. And Mark, I did want to mention one thing before we go back to regular programming today, that the governor did address the slowdown, the backlog for some people when getting their unemployment benefits. Some people have been waiting weeks. The governor called it unacceptable, and he said that they are throwing a lot of resources and time at processing unemployment claims faster to try to catch up. So I know it's been frustrating for a lot of people out there. The governor said, I don't want to make any excuses about it, but we are working on it and putting more resources toward that issue.
All right, the bottom line, we're going to get you back to regular programming. Phase 3, the reopening of the state. The next phase begins at 12:01 a.m. Saturday morning, and we'll see if 2 weeks later Phase 4 can reopen. All about the numbers. Those numbers are expected every day just after 5 o'clock. We'll bring those numbers to you later on today on the 208. That's going to do it for now. Much more coverage on KTVB.com as well as the news at 4. I'll see you then. Doug, I'll see you then as well.
All right.
In the meantime, we return you now to regularly scheduled programming.
Up to $10,000.